Disclaimer, these drawings are based on real photos but altered for comfort. The jokes are just to keep it watchable, not to make fun. Number 8. Stevens-Johnson syndrome, or also known as toxic epidermal necrolysis, is commonly associated due to an adverse reaction of the body to medication, in which rashes and blisters would appear over the infected areas and the top layers of the skin starts to die and peel off. Think of it like an onion where you peel off the skin, except it's yours, exposing the layers within. This violent reaction happens because of your immune system. Quite ironic, declaring war on your skin, which causes the blisters and rashes to appear, destroying the top layers of the skin, causing it to peel. When the infected skin is touched, it leaves raw and bleeding wounds. This disease doesn't stop there, though, since it can affect the mucous membranes as well, infecting the mouth, eyes, and the area around the genitals to blister and peel. In some severe cases, this disease can reach up to a 50% mortality rate. Number 7. Fibrodysplasia ossificans progressive, a genetic condition where both muscle tissues and connective tissues turn into bone. Typically appearing during childhood, the disease often starts at the neck and shoulders and may spread throughout the body. When this happens, the body's movement becomes limited. This often leads to difficulty in eating and speaking, hearing impairment, and permanent immobility. Makes you think if drinking all that milk is actually worth it. Due to the formation of extra bones in the body, the commonly known death of FOP is due to respiratory infections. As the conditions worsens over time, people with this condition typically have their life expectancy reduced to early adulthood. The only takeaway from this is that this condition is not contagious, since it is caused by a genetic mutation. Number 6. Necrotizing Fasciitis. Imagine your skin as a fortress, impenetrable, standing high and mighty. Now, picture an army setting up siege machines, breaking through and tearing down your fortress's walls on all sides, and then just when you think it's over, they start burning everything, performing a scorched earth tactic, except it's your enemies that did it. That is, in a sense, what necrotizing fasciitis is, sometimes referred to as the flesh-eating disease. It is caused by bacteria introduced through a break in the skin, which rapidly devours the body's soft tissue. Symptoms are debilitating fever, agonizing pain, vomiting, and before you know it, it's already all over your body. This disease often settles in unnoticed due to how many people would often leave minor wounds untreated. Like, imagine yourself on a weekend hike, and as you go about your hike, your foot slipped and you stumble over. Then suddenly, some sharp rocks tear through your clothes, wounding your knee. Leaving that wound exposed and uncleaned can lead to the disease causing an infection. And once it's there, it's too late. Number 5. Creutzfeldt-Jakob Disease, or CJD for short, is a rare brain disorder that causes dementia. It's a disease that affects both humans and animals, known as prion disorders. CJD is always fatal, as it affects a majority of the cognitive and physical functions, and that it usually gets worse faster over time. Symptoms can be memory loss, impaired thinking, problems with coordination, and trouble in speaking and swallowing. The disease occurs due to changes of a type of protein produced in the body called a prion. CJD usually develops sporadically, usually at the age of 60, although it can also be inherited. Fortunately, CJD cannot spread through physical interactions. However, there has been cases of it occurring after eating the meat of infected animals, although not all cases are caused by this. Another reason why checking the quality of your food is very important. Number 4. Harlequin Ichthyosis is a rare genetic skin disease affecting newborns. Babies with this disease are born with hard, thick plates of skin that cracks and split apart. You'd hope it would serve as armor, but think again. Imagine dried up mud puddles on the skin, but just as brittle too. Complications brought about by this disease makes it quite fatal, as babies affected by it have frequent respiratory infections, and trouble in eating. Fortunately, babies with this disease have a better chance of surviving, and with the right care, may even live to adulthood, thanks to advancements in medication and intensive medical care. Although it would be a lifetime of treatment, as this disease is a chronic condition. I guess as amazing as the thing is from the Fantastic Four, he has it quite rough. Number 3. Aquagenic Urticaria is an extremely rare form of urticaria, or hives, that causes a rash when coming into contact with water, or any water source. This water allergy can cause swelling, itching, and a burning sensations when triggered over the affected areas. Even the person's own sweat and tears can trigger a reaction. Seems like gamers can have a legit reason for not taking a bath. Extreme forms of this allergy prevent the person from even drinking water, since it might trigger a potentially fatal allergic reaction in the mouth and throat called anaphylaxis. As of today, there is no known cause for this allergy, but it is extremely rare that data on it is lacking, and because of that, there is also no cure for it. The recommended treatment would be to dry the affected areas and to take antihistamine medication. For a body that's roughly made of 70% of water, you would think it would know what water is. Number 2. Candle syndrome, short for chronic atypical neutrophilic dermatosis, with lipodystrophy and elevated temperature, quite a mouthful, is a rare auto-inflammatory condition that begins in infancy. Syndromes of these types are immune system disorders, resulting to chronic inflammation, progressive fat loss, joint and limb pain, and swelling of the eyelids, lips, fingers, and toes, frequently with a reddish-purple hue, are just a few of the many symptoms that can accompany Candle syndrome. Guess the name isn't that long for nothing. Candle syndrome is still somewhat new, so its prognosis requires more research. But the complications that comes along with it make it life-threatening, as much like other auto-inflammatory conditions, it can affect multiple organs causing inflammation among them. Number 1. Progeria is a rare genetic condition in which children rapidly age. Gives a whole new meaning to, I guess they do grow up so fast. It is a fatal condition in which signs of balding and wrinkled skins commonly appear on children with this condition. Other physical characteristics associated with this condition are prominent eyes and disproportionately small face compared to head, though these symptoms usually do not show at birth, rather a year or two later. As mentioned earlier, progeria is fatal, as all children affected by it have an average age of death of 14.5 years old, often much earlier, or in some cases around their early 20s. The cause of death for those affected is usually through complications that comes along with progeria, most commonly heart attacks or stroke. An endearing reminder to live a fulfilling life. These are the rarest and most dangerous diseases, and if you enjoyed watching, consider leaving a like. You are welcome to comment if you believe I've missed anything. Subscribe, and maybe I'll draw you badly as well. BDFD out.